Lymphedema is a chronic condition caused by a compromised lymphatic system that results in abnormal swelling of the extremities. Most often, lymphedema is the result of surgery or some treatment for breast, either prostate or gynecological cancers or melanoma, but people can also be born with it. Lymphedema is not a rare disease, yet many people with this incurable condition either go untreated or receive ineffective treatment. To help counter the lack of awareness, we at Medicircle are conducting a lymphedema awareness series featuring eminent vascular surgeons, physiotherapists, and especially plastic surgeons treating lymphedema to help raise awareness for all of the people, to help them find knowledge and innovations that support them to be able to live their best with this disease. Hi, I'm Smita Kumar, and today our guest for the talk is Dr. Anshuman Manaswi. Dr. Anshuman is a board qualified senior cosmetic and reconstructive surgeon, having a rich experience of over a decade. He's the senior consultant at the Department of Plastic and Reconstructive Surgery at Bombay Hospital and Medical Research Center, Mumbai, and is also associated with Nanavati Super Speciality Hospital at Mumbai itself. He's also founding director of La Transformation, a chain of cosmetic surgery facilities. Hi, Dr. Anshuman. Welcome to Medicircle.
Hi, Smita. It's a pleasure for me to be part of the show and to impart little knowledge which I have about lymphedema and some experience to the patients.
Sure, we are pleased to have you with us, and let's share more and more information about this disease and spread this awareness. So to begin with, Dr. Anshuman, what is lymphedema and what are the early signs of lymphedema?
Okay, so I guess the audience for this would be both the common people as well as the doctors, because the awareness of lymphedema amongst and the treatment of it is a little less even in the doctors, because there was not much of cure happening till around 3-4 years back. So I will try to be as less scientific as possible. I mean, layman's term,
Yes.
so that people can understand. So for people to understand, we must understand that like vascular chain of arteries and veins, the system which is there, which everybody knows that a pure blood from heart comes, goes to the tissues, and then the impure blood takes the blood to the heart. From there, it goes to the lungs, purified, and then again comes to the heart.
Yes.
So there are a network of pipes, or vascular system.
Okay.
There is one more system parallelly existing of the similar kind of pipes called the lymphatic system. And the main job of that is to carry the waste fluid or the fluid which are not drained by the blood vessels.
Okay.
And these go as chains, and then they finally go to a structure called as lymph nodes or glands.
Okay.
And these glands are present all over the body, like you would find them in the neck, okay, or in the axilla or in the groin.
Okay.
So they go over there, they get filtered over there, and some microorganisms and other things, toxic things are filtered over there. Then they go and then finally go through another chain of pipes which drain into the vein.
Okay.
So this system is just like a blood vessel parallel to it running with the same mechanism and very active system. It has got its own movement to parallelly drain the fluid, and like capillary action, the fluid keeps on going up. So if there is an obstruction in that system, the fluid is not able to go further and it gets accumulated. That is lymphedema. And to common people, you would probably understand that as hathi paw or elephantiasis. That is what they call hathi paw or hathi hath. And so the obstruction can happen at the pipes level, which is the lymphatic level. It can happen at the node level, the glands. I mean, I'm sure my audience would be able to understand that there are glands over here, which occasionally get swollen in infection and all that.
Yes.
So similarly, there are glands in the axilla and in the groin, in the thigh area. So they can get blocked, or there can be a problem beyond that. So there's a system anywhere there is a blockage, then the lymphedema occurs because of accumulation of the fluid.
Sure.
And the causes can be right from birth, when some people do not develop those many lymphatic channels.
Okay.
Second most important thing in the country, which is a national problem, or in fact, it's a global problem called Phalariasis, which happens in the coastal zone and the eastern part of the country, in which, because of malarial worms which are transmitted by mosquito bites. So those mosquitoes, they bite and they leave the worms in the lymphatic system, and they block the lymphatic system or disable the lymphatic system so that the fluid is not able to go up. So that is another major cause of lymphedema. And the third is cancer surgeries, wherein we remove the lymph nodes. Okay, suppose there is a breast cancer, then the axillary lymph nodes are removed in breast cancer uh, most of the times. So in that case, the fluid is from the upper arm is not able to go further from the arm. And that is how it leads to the swelling accumulation. In the gynecological cancers, again, because the lymph nodes are removed, the fluid gets accumulated in the lower limb, because the same glands drain from both the areas, from the breast as well as from the limb. It grows to the axilla from the gynecological area or the pelvis, as well as from the lower limb. The same glands drain the fluid. So if you remove the gland, the swelling will be there. So these are the three main causes.
Dr. Manasvi, can surgery is the only answer? Like many patients who are suffering from lymphedema are sometimes treated with surgery. So, what is the role of surgery in lymphedema, and can it be completely cured with it?
A very, very interesting question. Now, till around few years back, there were no cure of lymphedema, as I would say, and the surgeries which used to be there used to be very, very ghastly surgeries or very morbid surgeries. And in such a case, we were also not very keen on subjecting the patient to that kind of a big surgery with a lot of blood loss and a lot of morbidity. So patients used to suffer. And only treatment available was massages. But now, since last 3-4 years, some really good surgeries have come which can cure the patients. And if not cure, at least it can decrease the magnitude to quite an extent. And these surgeries are vascularized lymph node transfer, the lymph to vein uh, shunt, and then there are liposuction, there are other debulking surgeries. So we are getting very, very good results for last 3-4 years. Fortunately, uh, I mean, I would take a minute to say that we have sort of started one of the first centers in Mumbai for lymphedema care, where we have therapists, physiotherapists, plastic surgeons, all under the same roof, so that a comprehensive treatment can be given. And I want to make this opportunity to make the physiotherapists aware, the cancer surgeons aware, the physicians and the surgeons aware that yes, there are surgeries which can help these patients, which were not there
Okay.
but before. But at the same time, let me tell you that massage and bandaging form a very, very important part,
Okay.
okay, of this cure system. So surgery isolated may not be helpful unless and until we make the tissues soft before the surgery, make it more pliable, and continue it later on also. So yes, that is called manual lymphatic drainage. The massage process and 4-layer bandaging are very important. And then surgery, it's absolutely magical. You can probably see the improvement in 2-3 days. I mean, it's as fast as that.
That is really great to know that at least surgeries can help these patients suffering. And because lymphedema is if you see the pictures, if I would be sharing them in some time, so it's really, I mean, very painful to see them. One question on diet, Dr. Manasvi, that like what dietary changes we should be suggesting to a patient with lymphedema, and how much is that helpful?
Actually, not much,
Okay.
because the problem is mechanical. The
Okay.
problem is obstruction of some kind. But yes, fatty diets can increase the formation of the lymph.
Okay.
If we have a problem of lymphedema, I would advise them to have less and less fatty food so that less lymph is formed.
Okay.
Okay. But at the same time, make sure that we do not have the deficiency of essential fatty acids. There are essential and non-essential fatty acids in the diet.
Okay.
So omega-3 fatty acids and all, unki deficiency nahi ho jaye, and that is very, very important. But yes, less fat leads to less lymph.
So there is a lot of information on this website. And going at the top, see this is the lab transformation, and see these are the pictures, and there are all before and after results. I think Dr. Manasvi can help with a little bit more explanation on
Yeah.
these pictures.
Yeah. So the first patient is the patient of Phalariasis, and for carrying this lymph for last 10 years. And we did a manual lymphatic drainage preoperatively to soften the tissues. And then we did a lymphatic to vein shunt and see the result in uh, less than a week. This result is of around 1.5 months, but the results start coming in less than a week. The tissues become more soft. The second patient is a patient of breast cancer having lymphedema, and you can see the difference. This difference is literally within 4 to 5 days of surgery. Okay, and this is another patient of lymphedema for breast cancer, and this again we can see that there is a significant change after a week, 10 days. So yes, we are doing very good in lymphedema care, and I would be really happy to help any patient.
So thank you so much, Dr. Manasvi, for sharing this vital information on lymphedema with our viewers today.